Good morning, namaskar, sabal khair. Warm welcome to today's session on rethinking wellness and aging in the Zoom era. Myself, Kavita, a registered social worker by profession, joining you from the capital region, Ottawa. The foundation of a wellness culture in any community begins with ensuring a healthy environment for community members. To help encourage healthy habits and prevent harm, an impactful wellness program should consider its community members' physical, social, and emotional well being. In today's session, we were able to conglomerate all these three elements together to bring more awareness. Are you thinking, oh God, Kavita, give me a break? Because we get all these kinds of health related information on a regular basis through visual media, print media, like social media. And what is the relevance of today's session is what you may be probably thinking. I would say, oh God, I know it is a Saturday morning, but today's session is so relevant as the global pandemic took a big toll on our well being. So that's the main reason why MMAC decided to bring more awareness on how to prevent the risk of chronic lifestyle diseases and the need to be back on track. So it's like an opportunity which we are getting to recharge ourselves, recharge our batteries, right? And to get the right knowledge and resources. So are you ready to detox? Are you ready to reboot your system? That's my question. If your answer is yes, let's start this. So before we begin, I have to let you know a few house rules. So we are live on YouTube, and this session is getting recorded. So please mute your microphones to avoid any distractions. You may disable video if you're encountering any network issues for better quality. And we also encourage you to please ask questions through the chat box. If it is a question which is of personal nature, then we would encourage you to write emails so that the doctors will be able to give more answers. But please don't ask like personal questions in the forum is one request that we have. If it is a generic question relating to the topic, of course, you should ask those questions. That's what we would encourage. So in order to start this event, I'm going to call upon Fabi Naduanchar, MMAC's president, to officially inaugurate this session through a welcome speech. Fabi.
Oh, thank you, Kavita. So good morning and welcome everyone to MMAC's Rethinking Wellness and Aging in Zoom Era session. This session is being conducted as part of New Horizons Senior Program grant provided by Government of Canada. So I'd like to thank Government of Canada first for giving us this opportunity and funding to conduct the session for our community. MMAC stands for Malayali Muslim Association of Canada. Our goal is to cater to the needs of Malayali Muslims in Canada. We hope to bring community together through social events, social service initiatives, educational awareness programs, etc. This event emphasizes the meaning of wellness. You know, our wonderful panelists are here to help you navigate through the healthcare system and help you achieve best level of health. I would like to welcome our panelists, Dr. Salim Yusuf, Dr. Nisha Nigel, and Ms. Subaida Waliyamanatil Hanifa. Thank you, panelists, for clearing up your Saturday morning to conduct the session for us, and it's for the community. We have Ms. Kavita Kemenon as our moderator. Welcome, Kavita. It's your time now. Thank you all. Thank you, everyone.
Thank you. As Fabi already mentioned, we have wonderful panelists today to answer all your queries and to give more awareness on these topics. So first, let me say a few words about Dr. Salim Yusuf, who is the founder and executive director of the Population Health Research Institute. And he's also a joint member of the Department of Clinical Epidemiology and Biostatistics. He's a cardiologist at the Hamilton General Hospital and a professor in the Department of Medicine at McMaster University. Dr. Yusuf's research interests include the prevention and treatment of cardiovascular disease and societal, biologic, and genetic determinants of population health in developing populations. His team studies are conducted in 86 countries in all of the inhabited continents of the world. In 2013, Yusuf was named an officer in the Order of Canada. He's also a fellow of the Royal Society of Canada. In 2014, he was awarded the Canada Gardner Wigman Award and was inducted into the Canadian Medical Hall of Fame. In November 2020, he received the McLaughlin Medal of the Royal Society of Canada. Warm welcome, Dr. Salim Yousaf. Thank you for your generosity in agreeing to share your knowledge with our community members. And I know that on this Saturday, you're joining us from a cottage, which is even more exciting. So welcome. Now let me introduce Zubaida Valia Manatal Hanifa, who is a retired registered nurse with a BSc in nursing and CPMHN certification. Zubaida, like the steering committee member of the Network of Ontario Child and Adolescent Inpatient Psychiatry Services, is a visionary leader and an active global community volunteer. A McMaster University nursing graduate, Zubaida holds several professional certification, academic, and professional achievement awards. Zubaida has several years of experience working in mental health and addictions, corrections, and forensic held various positions, including administration, project management, educator, and worked across sectors, hospitals, communities, university, student health, correctional, and forensic treatment facilities. Zubaida has played an instrumental role in helping to create the Ontario Network of Child and Adolescent Inpatient Psychiatric Services, and more recently was one of the leads in contributing to and publishing the ONCAIPS Collaborative Provincial Child and Adolescent Inpatient Mental Health Standards. We all call her Zubaida Tata. Warm welcome to you, and we are really thankful to you for all the contributions. Now, let me also introduce Dr. Nisha Nigel. Nisha Nigel is an internist and endocrinologist working as assistant professor and staff physician at Northern Ontario School of Medicine. She has a keen interest in knowledge translation and has won the prestigious PSI Graham Knowledge Translation Award. Dr. Nigel has had advanced training in clinical epidemiology and research from University of Toronto. Her research is focused on metabolic bone disease and thyroid nodules. She has won several awards, including Young Investigator Award from Endocrine Society, United States of America. Good morning and warm welcome, Nisha. So Dr. Yousaf would give presentation on prevention of heart disease and stroke with emphasis on healthy lifestyles. Zubaida Hanifa would talk about emotional wellness and the social connection matters. That's the topic that she's going to cover. So first, let's start with Zubaida Tata, our darling Zubaida Tata. And from there, we will go on to the other panelists. Zubaida Tata.
Thank you, Kavita, for that introduction. Thank you for the opportunity on this panel to talk about emotional and social wellness. I'm delighted to join you, the audience, to discuss this important topic. Welcome, everyone. I'm going to, over 40 years ago, in June, start of the monsoon season in Kerala, I was leaving home, migrating to Canada. Fighting back tears, my mom said, eat well, sleep well, study well, get a good job, connect with the community, and talk to your brother if you are sad or upset, and write me letters. And don't sit there alone and cry if you're sad about something. Go see a doctor when you're not well. She also had packed my prayer garments and prayer beads, wanting to take care of my spiritual side of things. So a few years later, here I was doing the same thing with my daughter, starting the university and moving to residence for the first time. You might wonder what the story has to do with the presentation today. It illustrates the dimensions of holistic wellness. This time I'm going to ask Cheryl if you could upload that. I have only 2 slides for this presentation. So if you could upload the wellness slide, that'll be wonderful. So when you look at that slide, you can see it's a sophisticated way of viewing people. wellness is like, well, when you talk about wellness, we tend to connect everything towards the physical side of illnesses. So we'll say, well, I have no illness, or my diabetes is under control, heart problems is okay. So that's a kind of, but when I'm talking about the wellness, is the holistic wellness. So if you can take that slide down, that'll be okay. Thank you. Sorry about that. So when we talk about people, then let's say, okay, he's a diabetic, or he's a business person, she's a mother of 3 kids. There's many elements to our wellness. So when the pandemic hits, and we're still living through it, COVID-19 pandemic affected many aspects of our life. It was the health, the finances, businesses were suffering, our work suffered, kids were not going to school the same way they used to go, parenting. Sometimes you're a parent, sometimes you're a teacher, sometimes you're a teacher professionally teaching kids, and you have to look after your own kids teaching. Traveling, we all love traveling, and that was affected, and we couldn't even travel back home to see our loved ones. Social life, we can't go and visit the way we used to visit people. So when I talk about holistic wellness, it's not just about one element of it. So there are many dimensions. Physical wellness is a very important part of that, but also we need to look at all the other aspects. Let's say if we're free of illnesses, but then you have no money to pay your bills, and your children are not going to school, and you have to take care of it. So you get the point. So it affects everything. So I try to look at like some of the definitions for wellness. And I found this on World Health Organization. They define wellness as the optimal state of health of individuals and groups. And wellness is expressed as a positive approach to living. When I read that, it puts a lot of onus or responsibility on us as individuals to do something. It's not about eradicating all the diseases from the earth. It's about taking a positive approach to whatever ailments we have, or health we have. How can we optimize our health and wellness? What can we do about it? That's what it's all about. So I'm going to ask Cheryl to put up another slide on social demand connections matters. So that slide explains itself, what it's all about, right? It's self-explanatory. Maybe you can take that down again, and we'll put it up if we need to. Let me talk a little bit about social wellness. It's a sense of belonging. We want to belong to group. We want to belong to community. It makes us feel better. Many studies shows that if we have strong social networks, we live longer, healthier, happier. It also helps to regulate emotions, enhance self-esteem, improve immune systems, and lower anxiety and depression. So how important is that? Like, sitting with a friend or group of friends, talking about our challenges, especially during the pandemic time, it helps to someone listen to you. Whether they did anything, at least we can share some of the strategies we're using. Maybe a business that you never want to be in for a long time. Maybe this is a great opportunity now, the pandemic that brings us, maybe we can do. It all affects our wellness, right? So moving on to the next one, I want to touch a little bit on cultural and societal influences on us. When we talk about culture, it's automatically we think about food and the clothes we wear or the language we speak. But today, when I'm talking about culture and the societal influences, I'm talking about much deeper than that. The culture shapes our beliefs, our values, our perceptions, the view of the world. It influences our attitude towards accessing health, especially when it comes to emotional health. Studies shows that minorities are less likely to access treatment for emotional issues or will not seek help until symptoms are severe. Stigma is another big, huge thing. Stigma prevents 40% of people with anxiety and depression from seeking help. Just imagine how many people suffer in quietness and in pain. So those are kind of things to be aware of. These studies are not restricted to only general other population, it also affects us. When you look at the prevalence, in any given year, 1 in 5 Canadians experiences a mental illness or addiction problem. So we're not immune from it. So to recap, raising awareness and educating ourselves on holistic wellness, practicing self-care, taking care of ourselves to maximize and optimize our well-being. And at least you can prevent some illnesses maybe, or maybe we can reduce the severity of the problems that we have in all areas, whether it's a physical or social aspect of it, a spiritual aspect of it. Well, whatever that area is, we can do something about it. It's within our control, much of it. Understanding the societal and cultural influences can alleviate harmful misunderstandings, and we need to challenge our own biases and assumptions. Good to be open to hear and learn from experts in the field. Emotional well-being is deeply connected to physical well-being. Stress can worsen major health issues. And when you're under stress, even if we didn't get a good sleep or, we get grouchy. Even if your emotions are affected by that, not only your own emotions, but people around us, our loved ones. Sometimes I tell my daughter, go get some sleep and don't be grouchy around me. So at this time, I'm not an expert in this field. So I'm handing over to our expert, Dr. Nisha Nigel, our next panelist, to come on board and tell us about that. Thank you, Nisha. Welcome.
And thank you, Suvedata, Dr. Youssef, and Kavita, Febi, and everybody else from MMAC for coming together towards this common goal. I will start by saying that it's probably one of my favorite quotes from last year. A crisis is a terrible thing to waste. So this concept reemerges every time world has witnessed major catastrophes. We had this discussion going on after the Great Recession of 2008. And in fact, I guess, so Winston Churchill was the first person to be credited with first saying that never let a good crisis go to waste. So this was in the wake of end of World War II. So my presentation today will be a solution-oriented approach to the post-pandemic living. And as we all know, we did witness COVID-19 pandemic's economic and social effects being felt in every quarter of the globe. But thankfully, many governments, organizations, and communities are coming out with proactive efforts to make the best use of the situation. We'll surely be headed towards a new normal, rather we should. And how we react to this is entirely upon us. So my summary for today will be how we can be more involved and engaged in healthcare related issues as immigrant communities are struggling on many aspects, and probably suggesting some need assessment programs to be launched by our community to generate data, and coming up with tech-oriented solutions and how to engage especially seniors towards this goal, community fundraising, and some efforts on volunteering. And I'll cover some specific aspects on diabetes and osteoporosis management from a community perspective. And also, most importantly, how we can reach out to people who are silent and silently suffering for that matter. If you are attending this session on a Saturday morning, you're already part of the solution, but there are hundreds of other people who are silently suffering, and how as a community we can collectively reach out and or secretly engage them in a positive fashion. So I have a couple of slides on how the demographics in the world have changed. So we are witnessing unprecedented demographic shift. There are 1 billion people over the age of 60 living on this planet. And in fact, many of them are very healthy, active, and have discretionary income. So the population over this age of 60 is growing faster. And by 2050, 20% of the world's population, that's 2 billion people, will be over the age of 60. Unfortunately, the care gap is growing. We won't have enough people as potential caregivers for every person 80 plus. The ratio is going to be changing. So in 2010, there were only 7 potential caregivers, but it is shrinking. By 2030, it's projected to be 4 caregivers for every 80 plus person. And also, I think this group is also generating half of urban conception between 2015 and 30. So it's a huge demographic with huge potential to be tapped in a collective fashion. And if you look at Canadian statistics, we see that 2016 and between 2016 and 2016, that decade, there was a 94% increase in visible minorities age 65 plus compared to 27% in other groups attending hospitals and emergency departments. So the care demand is also increasing. So, and one aspect of, because we all will be taking up caregiver roles in different settings as we age, or, you know, even in our middle ages. So make sure that as a caregiver, we should learn to accept help, seek for help, set realistic goals, get connected with other caregiving resources, join support groups, which you're already doing. So those are some aspects. And a couple of things about how Canada is focusing on its pandemic recovery planning from a geriatric perspective. So we're going to be seeing more person-centered, integrated approach, consistent, and probably more funding on long-term care and geriatric facilities. So there's also talk about specific or dedicated emergency rooms for geriatric people so that the care can be focused and things like that. So a lot of common themes are emerging in terms of financial aspect, health, cognitive health, you know, dementia, memory aspects, social and connectivity aspects, mobility and daily activities of living. So the outlook is definitely promising. Now, looking back, or, you know, addressing the main issue that we as South Asians face is diabetes and cardiovascular health. So Dr. Yusuf is going to be addressing the cardiovascular aspect. So from diabetes perspective, I want to let you know that there are numerous community resources and system resources that we can avail. You don't have to wait till you are 65 to be availing those resources or get your medications free of cost. There are numerous resources available to guide us through a preventative approach to diabetes. Right now, the approach is reactive rather than preventative. So we are waiting till we get a diagnosis. So in terms of general wellness, stress, physical activity, there are numerous resources available. So, you know, as a community, you know, I would suggest maybe start off with doing community walks, virtual fitness activities, resistance training that everybody can be part of. It doesn't have to be a senior oriented or as a collective group. And, you know, girls, young women with PCOS, it's a very common problem that leads up to like the metabolic complications and consequences such as diabetes, all interlinked. Metabolic syndrome, you know, care after pregnancy, so many things to rethink and readdress in positive and engaging ways. And we have a lot of youth volunteers, young immigrants who are full of energy and full of talent, so make use of them. And Diabetes Canada is an excellent resource. They have a very interactive website, so you can make use of those resources when you're doing community. So I consider all of these attendees today as leaders. So you are going back to your community or neighborhood or friend circle and teach them. So this is more of a resource-oriented approach. So there are a lot of resources available on Diabetes Canada website. So coming to diabetes in elderly, you know, geriatric syndromes can be diabetes complications. So, you know, you are facing seniors with poor muscle strength, disability, they're at higher risk of falling, dementia, urinary incontinence. And then also they're on polypharmacy. There are system-based approaches to address these issues. You know, maybe you should get the senior, you know, who's struggling to talk to a community pharmacist. They have enough resources and expertise. You don't need to always wait till a doctor is available. You can reach out to a diabetes dietitian or community-based dietitian, pharmacist. They have had excellent training in helping you sort out these issues. And these are all guideline-based, evidence-based, so polypharmacy, overuse of medications, and there's a lot of attention towards deprescribing as well. So there are, even outside of your family physician's clinic, there are community resources, okay? And coming to bone health also, I'll just say, because it's all tied to exercise and physical wellness, you know, you're falling and frail, having at high risk of getting a fracture, losing your independence, going to rehab. It's all expensive, costs add up. So, you know, Osteoporosis Canada is a very good resource. You can access all their resources free of cost, and you can also invite their community engaging partners to come give us talks, etc. So there are OsteoFit workshops, and there are community fitness centers, and you can also avail for individual coaching. And coming to a lot of financial assistance programs that are available, you do get assistance towards getting special glucose monitoring device, let's say devices to get glucose checking. Fortunately, if you're on insulin, the Libre glucose meter is now covered for everybody older than 65. Our governments are providing a lot of resources free of cost to manage your diabetes, mainly because it is a major driving factor for cardiovascular disease, like, for example, your risk of getting a heart attack and stroke, etc. So it's a major consumer of our healthcare resources. So preventative care is also being addressed. And of course, if you are an employee of a big organization or even a small business, advocate for wellness programs that can be collectively accessed. And so the cost can be shared by the employer and the employee, or if you are part of a big corporation, continue to advocate for more resources, collectively, online sessions, therapy, coaching, diabetes, nutrition, counseling, etc. So that way the resources can be shared. Not everybody needs to reinvent the wheel. And ODB and OHIP, of course, all the medications for diabetes. Fortunately, all the new medications that are very effective in preventing diabetes complications, even preventing heart problems, stroke, kidney disease, etc., are being available free of cost. It is upon us to engage and ask maximum number of questions and clarify all your doubts. Advocate for yourself. Probably, if needed, get referred to a specialist or get proper advice from your family doctor. Be informed and aware about all the new developments in the field of metabolic disease, diabetes, cancer, etc. A lot of things have changed. And also, as I said, Ontario Drug Benefit is a very good program providing prescription drug coverage. Ontario Works, Trillium, they're all, if you contact a social work, they will let you walk through all these options. Numerous resources available, and also medical identification bracelet, etc. I have a feeling that a lot of these services are underutilized by in immigrant communities. So that's something we as leaders should advocate for. And also, Canadian Diabetes Association has good resources for dietary coaching and nutrition. But we can create our own culturally appropriate resources in Malayalam or other South Asian languages. Resources are available. You can apply for funding, and also reaching out to food banks and engaging in volunteering activities, reaching out to dietitians, invite them, like as I mentioned, and also community-based food care program. And you will be surprised to know that a lot of things have been already addressed, especially in Peel region, etc. It's just that we are not heavily involved in these activities. So there is even a South Asian task force and all that. These were put in place even before the pandemic. So I guess we can engage with people in more innovative ways, I should say. So, there have been talks about creating community-specific websites, online chatting platforms, portals, tailor information to suit dietary customs and practices of various, South Asian culture is very diverse. Within the community itself, we have different aspects that can be addressed, providing hands-on workshops and seminars and all this. Even industry partners will be willing to fund and support these initiatives, because everybody wants to prevent diabetes and other metabolic consequences, cardiovascular disease, etc. And most importantly, engage our youth in productive fashion. They will be able to volunteer and help and in fact, take up leadership roles. And we have to heavily rely on our youth members to take up leadership role, which they're immensely capable of. And things like community cooking workshops, and we all know how to eat healthy. We all know what to do, but continued reinforcement of behavioral aspect. So the behavioral part is the most challenging thing. Like as Kavita rightly mentioned, all this information is available, and you're being bombarded with stuff on WhatsApp on a daily basis. So that the reinforcement part comes through behavioral intervention. So that needs continued engagement with the community. So, and I also saw this flyer of South Asian Health Expo. So that's something we can reinvent or relaunch in the post-pandemic world, engage with vendors and other partners that are providing virtual care, virtual wearable devices, etc. So a lot of things. So the strategy I mentioned is available on Google. So I think it's called South Asian Health and Wellness Strategy for Ontario. It was published in 2018. So a lot of work has already been done. We just have to add more and reinvent So that has been, I think, one of the major silver lining of the pandemic is that how we are going to rethink about work-life balance, mindfulness, productivity, and focus on things that actually matter. It's quality versus quantity. And a lot of employers are also rethinking, redesigning workspace, which are already experiencing. And one of the biggest changes, I'll say the silver lining of the pandemic has been interest in technology and fast adoption of technology in wellness. It was already there, but most of us were aware or not using it because it was not culturally adaptable. There were language barriers, internet barriers, access, and etc. But thankfully, it is taking a bigger role in improving our lives, especially for seniors. For example, there are ride-sharing services, banking services solution. Those things are all being made simplified so that seniors can access, and even people who are illiterate on technological aspects can use it, right? Even as physicians or other healthcare, because we sometimes are ignorant or not aware of other developments happening in the technology field. So we are also struggling. If I go to a bank, and I don't think I'm making good use of all the tech aspects of my online banking. I just do my basic things. So with more training, we all have to adopt to this new normal. Just a motivational thing to say. And same thing is happening in geriatrics. There are advanced fall detection devices, medical alerts. So it's all easy, so there are predictive algorithms being incorporated into diabetes management, glucose management, everything. So in my field, I'm already experiencing those technological aspects taking over diabetes management. It's happening in a huge way. It's already happening. So we just have to train our people to start using it. And recent versions or updates are all simple and very user-friendly. So a lot of innovations in geriatric wellness and so many helpful ways in which we can engage not just seniors, and it all has to start. Don't wait till you turn 70 to start using these. It all has to start in your middle age as well, so that you can be prepared for your 70s or 60s. So you have to start early. And probably I would suggest that we should potentially arrange a technology camp, a tech camp focused on wellness. You can invite vendors and partners and do some workshops, hands-on training, etc. That will help. That will motivate, and also do some fundraising. And like food banks, we need to have technology banks, and also create some technology advocates from seniors. It'll be nice if a senior member or influential person from the community itself can be a technology wellness expert, things like that. So, and also gathering resources to caregivers. And now coming to various diabetes treatment aspects, or for that matter, any new medication. We saw how vaccine development evolved real time in front of us. So similarly, a lot of advancements have been happening in cancer therapeutics, how we treat and prevent heart attack or stroke or diabetes, etc. So how can we be part of these advancements? One thing will be, talk to your family doctor. A lot of newer medications and technological stuff, gadgets are available as free samples. Do take part or volunteer in clinical trials. That's how we can generate our own data. Right now, we will see that proportionately more Caucasians are taking part in clinical trials, mainly because a lot of resistance from our people to take part in clinical trials. Be part of the solution, be willing to take part in clinical trials. So thanks to thousands and lakhs of volunteers, now we have vaccines. So these were selfless volunteers who took part in clinical trials, and reach out to social workers, and also be aware of all the other resources I just mentioned. So that's how you can be a productive partner. And another important aspect, which Dr. Yusuf is our role model on evidence-based medicine. So how did McMaster University or PHI came up with the evidence-based concept? That mainly by generating data. So we do need more data. Data comes from, there's only so much a government can do. So we as communities should be able to do our own needs assessment survey, our own, generate our own demographic data, contact surveys, collect data on gender, disease status, how many of us have diabetes, how many of us have heart disease, how many of us have cancer, how many of us are accessing certain cares, things like this. Generating data will help us advocate towards achieving our specific goals or specific demands, right? So reach out to other organizations. It doesn't have to be confined to one particular community or one particular ethnic group. Reach out to other South Asian communities. There's a lot we can learn from each other. So probably they've already done a lot of research in on a specific topic. So you can just share and contribute. So those kind of community outreach to other communities are very, very important. And also reaching out to, these days we are seeing a lot of, literally thousands of new immigrants coming. So reach out to them early on, try to engage them, irrespective of religion or language, etc. Reach out and engage and how they can be engaged early on. Because we do see that early new immigrants have a higher risk of heart disease, stroke, or, addictions. They're going through a lot of stress. There's a lot of struggle as a new immigrant. So the disease proportionately, it is brewing in them when they come, and so a lot of cultural barriers, etc. So that is one community we should start targeting early on. And another important aspect, which I think we are lagging behind, is voluntary in terms of every aspect, volunteering in clinics, volunteering in hospitals, volunteering in food banks or other community level facilities, etc. So that is really good for your mental wellness and also physical wellness, of course, at different levels, actually, and also be part of a lot of, or maybe create innovative ways to raise funds, especially for the hospital. So there is so much we can contribute towards our hospitals. There's always need, we all will be utilizing these healthcare services in some form or other. So fundraising is an important aspect. As a community, we should focus. And one more aspect that I will stop with mention a brief mention about infodemic. So we are bombarded with information from all sources. There's an overabundance of information, some accurate, some not. And so it is making it hard for us to find trustworthy resources and reliable guidance. So make sure that as a community, we reach out to the real experts, not WhatsApp forwards or Google. So we have to make sure that this should be translated into actionable behavioral change messages so that people are not being misguided towards misinformation or false information. And also remember that anecdotes are not data. It's not evidence. So we should not be carried away by false evidence or false information. So I'm happy to take questions at the end of the session.
Right now, let's welcome Dr. Salim Youssef, who is going to speak about the prevention of heart disease. And at the end of the session, we can certainly take questions from the audience.
Well, thank you, Kavita, and thank you for the audience. There's about 40 people on a Saturday morning. That's reasonable. When I was 16, one night, I was woken up in the middle of the night, and my father said, please go and get the doctor. He was having a heart attack. We didn't know what to do. And in fact, the doctor didn't know what to do either. He was sent to a local hospital in Cochin, and he was monitored. But they didn't, other than painkillers, morphine, and a form of drugs that could suppress abnormal beats, they didn't use anything. Today, we know none of them do very much. And in those days, it was in the 1969, there was really no treatments for heart attacks. 50% of people who got a heart attack died within a year. Today, it's a very different picture. We did not know what were the causes of heart attacks then. We didn't know how to treat them. We didn't know how to prevent a second one. Some 5 years later, my father had a second heart attack, and another 4 or 5 years later, he had a third heart attack, and he died at the age of 56. So this story is not uncommon. Many of you here have witnessed such stories. And so the question that I want to address are just three. First, what causes heart attacks, and what can we as individuals do to reduce our risk of heart attacks? I'm going to focus on heart attacks because strokes are very similar, and much of what I say also applies to strokes. The second thing is, very briefly, because this is not a technical talk, I will tell you of the advances in the acute treatment of heart attack that has reduced the risk of dying from 50% at 1 year to 15% at 1 year. So it's still significant, but it's reduced by 2/3. And the third is what we can do to prevent a second heart attack. And that too, we can now prevent 75% of the new heart attack, so that if somebody treated in the old days had a 25% risk of getting a second heart attack after the first one, we can reduce it down to about 5%. That is huge in about 40 years. And I'm pleased to say I've been part of the story. And as Nisha pointed out, it's come through research. And it's come through research in animals, in test tubes, but most importantly, through research in people and people volunteering to be part of the studies. So the first is what causes heart attacks. You can come up with a long list of things, but most of which are scientifically proven. But the most important one is smoking and tobacco use. Now that I think we didn't know that in the 1960s, but we know that today. So the most important thing you can do to prevent a heart attack is to avoid use of tobacco. And I think cannabis and some of these new things are probably just as bad. We don't have the data, but I feel it's an external toxin and you don't need to wait to get the data. And smoking increases the risk of a heart attack by 250%. And it increases the risk of a heart attack in young people by 600%. So if somebody is smoking at the age of 25, by the time they get to 40, they've increased their risk of a heart attack 6-fold. That is huge. The second thing is abnormal cholesterol. I won't go into the details of cholesterol, but one of the things is to get your cholesterol checked fairly early in life, and my God, my computer is about to shut down. I'll put it to snooze. Okay, so very early, check your cholesterol. There's a small proportion of people who are born with a genetic abnormality and their cholesterols are very high. Today, we know how to treat them and we can prevent these people from getting a heart attack. At least we can reduce the risk by about 80%. So check your cholesterol. That's the second thing. The third thing is check your blood pressure. High blood pressure, again, is a very strong risk factor for heart disease, for strokes, and for kidney disease. And again, it's easily treatable. There are ways of preventing it, which we can talk about. The fourth is diabetes. Nisha touched on it. Diabetes increases the risk of heart disease by about 2-fold. Number one is tobacco, high blood pressure, and cholesterol, or the bad cholesterol. And following that would be diabetes. And today there are ways of not only treating diabetes, but also preventing diabetes. And that's worth knowing. We'll come to that in a minute. Then there are other things like an unhealthy diet. The challenge with a diet is diets vary markedly in different parts of the world. You all know what somebody in North America, say a person of European origin, consumes is very different from what is eaten in India. And even an Indian eating in India is very different from an Indian eating in Canada. So diet is much more complicated to understand, but we can touch on some common themes. And then there is lack of activity. This is a simple one. No matter where you are, who you are, the less active you are, the worse your risk of heart disease. So 3 things that we can all do for ourselves is avoid tobacco, both direct smoking as well as being in the presence of other people smoking, which is called secondhand tobacco exposure, which is bad. Healthy diet, I'll spend a minute or two on it because there's a lot of misinformation on diet and activity. And activity, moderate activity, is all that's needed, which is walking several times a day for 10 to 15 minutes. Some activity to improve the strength of your upper body. So think of all the things that you want to do. You know, you want to lift something, you want to get up from a chair, you want to climb stairs, you want to be able to garden. Well, do each one of them as many times a day as possible. And in today's culture where we have cars and transportation, make sure you still get that activity. It could be walking, it could be doing things in the garden, it could be anything. You don't have to go to a gym. Of course, that would be good, but it's not essential. Now, people always ask me the question about alcohol. And I'll tell you, alcohol is quite neutral in low quantities, maybe slightly protective, but largely neutral. And in high quantities, it causes a number of diseases, including cancers, heart disease, liver disease, brain disease, and a huge number of things. So if you don't consume alcohol, I wouldn't encourage you to do it. If you consume it in small amounts, that's okay, but certainly avoid large amounts of alcohol. And I'm not touching into the sort of religious thinking or all that. I'm just giving you the health information. Now, Zubaida at the beginning of the talk talked about social and psychological issues. These are very important, and stress matters a great deal. Now, there are three kinds of stress. First, there is good stress and bad stress. A good stress would be you're working very hard to get something important done. You have your daughter's or your son's wedding, and there's a lot of things that you have to deal with. But these are things that we have to deal with, and many of them could be good stress. As long as you're in control of the situation, you're able to manage the stress, and actually that types of stress doesn't hurt you. But a second type of stress is where you have no control over things. It's called loss of the locus of control. So there are extraneous factors and you feel helpless to deal with it. Those are the bad kinds of stresses, and it's important to learn how do you avoid them, or inevitably should they come, because life is one long stressful journey. How do you deal with it? And so I would suggest to people, think of various ways to relax. It could be meditation, it could be prayer, it could be walking quietly, it could be spending time with friends or family. These all reduce stress. Now, there are connections with other people socially is very important. And Zubaida mentioned it. And through connections, what we call social connectivity, we avoid isolation. People who are isolated tend not to look after themselves. They tend not to eat a healthy diet. They have less information of how to access healthcare. And so make sure you have a few friends, few good friends. You don't need large social networks. A moderate sized network of a handful of people, say 6 or 7 close friends, with whom you keep in touch regularly, several times a week. It could be family, it could be friends, is important. Then there's something called social capital. That means the total amount of resources in society that can support you when you need help. It could be the healthcare system. It could be friends. It could be a club. It could be a religious organization. As long as people support each other and people know where to go should they need help. It could be help in information. It could be help in a stressful situation, or it could be even help financially. So if you know there are people who can help you, that also helps. So the social part is now emerging as a very important part of things that you can deal with. So look after yourself, but also make sure you have friends and close family. Now, I did not touch on weight. Weight is an important issue. Being overweight is not too bad, but it's better not to be overweight. But being obese, which, there are formal definitions of it, especially if that obesity is around the abdomen, that increases the risk of diabetes, as Nisha will tell you, but it also increases a dozen different conditions: heart attacks, strokes, joint problems, depression. Socially, people who are obese are less welcomed into circles. So I think the key about obesity is we don't know a whole lot about obesity, but the things we could do is to be active as much as possible. I'm not talking about exercise. Be active. So if you've got a job that's a desk job, make sure, every hour you get some walking. You go and meet another colleague at the office. Go to the water fountain and get a glass of water. Walk up and down the stairs. Park your car, not right at the door, but a little further, and walk to that. Gardening. So activity is key. I'm not saying exercise. And in diet, people, okay, let's spend a few minutes on diet. The conventional thinking on diet is avoid high fat foods. That probably is now being shown not to be totally true. I don't think you should have high fat foods, but you don't have to go down to zero fat foods. The key thing is to reduce the amount of carbohydrates, especially processed carbohydrates. So like white rice, white wheat, all that. But there are other forms of carbohydrates, what are called whole grains, or carbohydrates you get from fruits. Those are good carbohydrates. So changing from bad carbohydrates to good carbohydrates is good. Eating a lot of fruits and vegetables is good. Eating a small amount of meats or fish is good, especially if it's not fried. Lightly, a small amount of oil is good. And some oils are healthy indeed. I personally don't tell people don't eat butter or anything like that. Butter is natural. Some amount of it is good. In Kerala, there has been the long controversy about coconut oil. Again, a small amount of coconut oil is fine. You don't have to make it zero. The types of oils to avoid are the synthetic oils. And those are the things that have things like trans fats. Don't reuse oil that's been already cooked because it's changed its chemical nature and then can be harmful. The last couple of things to remember is we're living in an era where three things we're becoming aware of. The first is education actually prevents heart disease. I mean, this is something that people did not quite know in the last few years. We've done a series of studies showing that the more educated people are, the less incidence of heart disease, the better outcomes of heart disease. Part of it is because people lead a better lifestyle. Part of it is they know how to access help when they know it. And educated people tend to have better social networks. I think if you ask me, what is the number one intervention, if I were the government, I would do to improve health in populations, it would be education. And it'll help across all forms of things. And nobody will argue with that. So if you want to contribute funds for improving the health in any country or your community here or a community in Kerala or immigrant community, contribute to improving the education of children. They'll grow up to be healthy adults. The second one is increasingly now pollution is bad. Both indoor pollution as well as outdoor pollution. Indoor pollution can be from things like cooking with wood or coal or agricultural products, as is happening in India. Half the world actually use such materials. We don't see that in Canada, but certainly in Kerala, a third of the homes still use unclean fuels. The clean fuels are obviously electricity and gas. The last one is climate change really matters. There is increasing information that for every 1 degree increase in your ambient temperature, over 20 degrees in the ambient temperature, the risk of a heart attack or stroke goes up 5%. Just think of it, 1 degree, it increases, it goes up 5%. And so anything we can do, now individually, we'd say, well, we're helpless as far as climate change is concerned. That may be true, but on the other hand, there are lots of things we can do to follow practices that could minimize climate change and global warming, including, how we lead our lives, whether we walk more than we take buses or cars, whether we drink bottled water or tap water. And you'd say, what does bottled water have to do with climate change? Well, bottled water, somebody's got to bottle it. Somebody's got to transport it. And that means you're using fossil fuels for these things. And finally, there's an election on Monday. I'm not telling you who to vote, but take climate and the environment into account in deciding who to vote for. And challenge the candidates as to whether they have policies that are climate friendly. In India, it has got one of the worst air pollution records in the world, probably worse than China now. And it's estimated that 1/3 of deaths in India are due to poor air quality or war or climate change or environmental degradation like insecticides and pesticides. So these are general issues are worth remembering. So we have the political and the social dimensions, climate, environmental degradation, air pollution, social networks, making sure you keep friends. There is the individual behaviors, which is a healthy diet, especially a low-carb diet, diets rich in fruits and vegetables, increased activity, and avoiding tobacco. These are all the things you can do. Now, I'm looking at the watch. It's nearly 11, so I'm not going to the other aspects of what we could discuss. That will take another huge session. Remember, it's 40 to 50 years of work of hundreds and thousands of people around the world that have made these advances. So I'll stop here to remind you what you can do. Definitely don't smoke, prevent others smoking. Healthy diet, lots of activity, and live in a healthy environment, including a healthy psychosocial environment. Thank you.
Thank you very much, Mr. Yusuf, for that wonderful presentation. It was wonderful to hear from you. I just want to ask the participants if there's any questions, please do write in the chat box. We received a nice message from Irfan Habib, who have congratulated all the organizers for arranging this program. That's so nice of you for writing. If there's any more questions, we can certainly ask, because we still have 5 more minutes and we will wrap up. Because all the panelists have covered almost all the aspects of mental health, like emotional well-being, social well-being, even the environmental issues as well. So if there is no other questions, then we can wrap up, because it is already 11:07.
Kavita, maybe I can make one suggestion or a comment, actually, because I do have a lot of resources that we could be sharing, but it'll be given to the organizers and they can decide how they're going to distribute it to the people. When I was hearing Dr. Nisha Nejal, she also have a lot of resources and may be very beneficial and for people to know, but it wouldn't be, it'll be go through the organizers, not directly to me either, right?
Yes, so they should be getting in touch with the MMAC members to get more information. And over here, Irfan Habib has sent a link, www.senseandcare.com, and he says that there is more information with regard to like well-being of the elderly. So please check it out. So with that, I think we can wrap up today's session.
I mean,
Because
if there are general questions, they
yes.
can put in the chat box. We can wait 5 minutes and ask and address them, because the people who joined obviously are interested in health. So that would be useful. But specific questions, please talk to your own doctor. You know, it's impossible to give good advice without a careful history and careful assessment.
Yeah, so true, doctor. More than 200 people have joined us today through the Facebook Live. People are all viewing, and more than 40 to 50 people are here in our Zoom session, which is incredible. Thank you, everyone. I don't think we have received any more questions today, and all these panelists have covered all the aspects. So I'm kind of assuming that it's a Saturday and you're all having your own busy schedules, and we respect that. I would like to welcome Mr. Shiaz Sharaf for the final vote of thanks.
Good morning, everyone. This has been a very informative and captivating session. First of all, I would like to thank MMAC for giving me the opportunity to present vote of thanks for New Horizons Senior Program by the Government of Canada. I would like to thank Government of Canada for giving us the opportunity and funding for this endeavor. On behalf of MMAC Care, Cumulative Aid for Resident Elders, I would like to thank our panel of special guests, Dr. Salim Youssef, for sparing his valuable time and sharing his precious knowledge with us. My heartfelt thanks to Dr. Nisha Nigel for her exceptional warm-hearted help in providing us information on Canadian healthcare system, and Ms. Zubaida Walyamanathal Hanifa, who has always been a part of our MMAC family. And I thank her for your devoted support throughout this event. And without you, this event would not be a success. And thank you, Ms. Kavita K. Menon, for moderating this session wonderfully and engaging us all. Lastly, I would like to thank the MMAC Care Cumulative Aid for Resident Elders team, who have been very diligent behind the scenes to make this event happen. Once again, thanking you all for participating on this Saturday morning. Have a good day.
Thank you, Shiaz. With that, let's wrap up today's session. If there is any more questions, you can write email to contact@malayalimuslims.ca. And please check our website to know more about the upcoming sessions. So thank you very much. It was really nice seeing you all, and stay safe and take care.